you, Councillor Fairhurst. So the purpose of this report is to seek approval from the executive member to recommission our support contract, which is 7,235,000 for across the county, for a contract that will be 3 years +1+1, and this would commence from the 1st of December. This funding is using ring-fenced resettlement grant that is from the Home Office, so it's wholly funded from the Home Office, and we follow funding instructions. So we have an obligation under the Home Office instructions to ensure resettled individuals are supported to integrate into the UK and specifically into Hampshire for 3 years. So we have seen an increase in demand, particularly around Afghan households since 2021. And these are under different government schemes, which from the 1st of March are now in one scheme called the Afghan Resettlement Programme. It does also include the UK government United Kingdom Resettlement Scheme, as well as the Afghan scheme. And the service ensures that we support Afghan refugees from the time of arrival, things like understanding statutory benefits, finance, health, registering for GP, all the way through to adult and children's social care if required, and education and employment and training and employability. So we currently have a provider who is delivering this for our Afghan refugees across Hampshire, and this comes to an end on the 30th of November, hence why we are asking to recommission for our refugees across Hampshire. As I said, all of the costs will be covered through the Home Office ring-fenced grant, and we are currently supporting just under 300 individuals across Hampshire, and this contract will set to be able to support people, 300 individuals, on a yearly basis.
Thanks, Jackie. We're still getting new refugees from Afghanistan, aren't we? Do you have an idea of how many per month are coming into Hampshire?
So that's a very good question, and it does depend on if we have the housing available, which is what we work really closely with our district and boroughs. And so we will only accept refugees once we've got the housing in place and directly matched. So it does differ, but it's often, I think it's around about 10 a month. Lisa might correct me if I'm wrong, but she nodded, so that sounds about right. So on average, around 10 a month.
And they go directly into homes now. I remember visiting the hotel in Basingstoke with you, where some of them seem to be stuck within the hotel for an awfully long time. So
yes, absolutely. So this is for actually people who are directly matched. So when they are directly matched with the Home Office and we've got the availability of a home, then absolutely they come directly through into that home, and then we put in the support, the integration support. There are different schemes where some Afghan refugees do go into what's called transitional accommodation, and at the moment that's often MOD properties or private accommodation, but this scheme is solely for ones who are directly matched with the Home Office and they've got the home that we've already secured with our district and boroughs.
Super, thank you. Councillor Withers.
I think actually we've got to do this, haven't we, really? It's not a question of whether we want to. It's a Home Office policy, and as such, as a county and a local authority, we've got to abide by that. So obviously I endorse it for as long as it lasts.
Thank you. Sorry, Councillor Oppenheimer.
Well, I'm very happy to voice my support for this. I think Hampshire's got a good track record when it comes to welcoming refugees from war-torn places, Afghanistan, Ukraine, and I think we can all be proud of that. So thanks for the paper, and happy to voice my support.
Thank you. Councillor Minahan.
Nothing to add, Liz. Thank you.
Nothing to add. No, well, thank you very much, Jackie. More than happy to approve. Thank you.
Thank you very much. Thank you.
And you can stay if you want, or you can leave if you want. Entirely up to you.
If that's okay, Councillor Fairhurst, I'll leave. Thank you.
Okay.
Thanks.
Right. Second thing on the agenda, it's Jess under the savings programme. Over to you, Jess.
Thank you, Liz. So this is a report with regard to a proposal to cease appropriate adult funding on the basis that that isn't a statutory responsibility for the local authority to provide. But I will hand over to Jason, who will give us a brief description of the report. Thank you.
Thanks, Jess. Afternoon, Councillor Fairhurst. As Jess says, this paper is in relation to grant funding that the County Council currently makes for the provision of appropriate adults for vulnerable adults. Specifically, this does not cover the funding for children. It's not in scope for this paper, so it's just really important that we're really clear about that. The recommendation is that the cessation of the funding is agreed on the basis, as Jess said, that we have no statutory obligation to provide that funding, and obviously reflective of the council's financial position. In terms of context, when somebody is detained for questioning by the police have a responsibility to determine if that person is under 18, but over the age of criminal responsibility, or a vulnerable adult. And the vulnerability is generally around any presenting characteristic of the person in terms of their communication or understanding. And if the police feel that somebody meets that criteria, they have a responsibility to ensure that there is an appropriate adult in the session, in the questioning with that person. And the appropriate adult is essentially there to try to reduce the chances of a miscarriage of justice. So they do that by helping the person to understand their rights, to facilitate the two-way communication with the police, and to just generally make sure the police act fairly in their interactions with the person. And anyone can be an appropriate adult. Anyone over the 18 can be an appropriate adult. But for cases where the person is unbefriended or can't make contact with their chosen person, then the police will call in an appropriate adult from this service, which we help to fund. As Jess said, there is a anomaly within the legal framework, which means that there is no statutory duty on anyone to provide funding for the appropriate adult service, although there is a duty on the police to ensure an appropriate adult is in attendance in those circumstances. And that's a different legal structure from children's. There is very much, very clear legal duty on the local authority to make sure an appropriate adult is available, and that funding is separate from this funding. Service in this case is funded by the OPCC. There is a provider called the Appropriate Adult Service, which is a provider which works across the country, and they interact with the police and will provide appropriate adults as and when requested. We have been contributing funding to this service since 2021, previous executive member decision, up to a total amount of £386,085, with the current grant funding period due to end in June 2026. So what we are proposing here, on the basis that this is not something we have to fund, is that we use a termination clause within the grant funding agreement to provide 6 months notice to the OPCC, which would mean funding ending in September of this year. The OPCC have been engaged on this issue. There's been no requirement to formally consult on it, but obviously we have spoken to the OPCC. They recognise that there is no statutory duty on Hampshire County Council to fund this service. They did argue that it aligns very much with our kind of broader health and social care outcomes as defined in the Care Act. They did kind of raise a concern that as they're seeing demand increase, that obviously this funding reduction would be problematic for them. And they did ask if we might consider a reduction rather than a full cessation. However, our financial situation is such that we feel that we do need to cease the entire grant, unfortunately. The OPCC have subsequently confirmed they would rebadge funding for the remaining duration of the current arrangement with TAS. So there'd be no change effectively until that finishes in sort of June 2026, and they would conduct a full strategic review leading up to the end of the current arrangements, which obviously Hampshire County Council will contribute to if we're requested. So there is some assurance around the short term, but not in the longer term. I think there is still a question over what will happen in the future there. The Equalities Impact Assessment has been completed, and so looking at the immediate impact, we have assessed a neutral impact because there would be no effective change, at least until the summer of 2026. So just to recap, the recommendation is that the proposal to cease the funding and use the termination clause is approved. If we did so, we would provide 6 months notice. And we have arrived at this conclusion because there is no statutory duty on the County Council to fund this service.
Yes. Thank you, Jason. I'm aware that they're quite relaxed about us withdrawing our money. Nobody likes having money taken away, but they're quite relaxed because they have it covered to July 26th. And then we'll have to wait and see what their review comes out with next year. But other than that, I can see no problems. So, Councillor Oppenheimer.
I don't have anything to add on this one, Liz.
Okay.
So thanks.
Councillor Withers, where have you up there?
No, no, I agree as well. I fully endorse the cessation.
Thank you. Councillor Minahan.
Yeah, I think it's quite straightforward, really, to be honest. Thank you, Liz.
Yeah, thank you. Right, very happy to approve then. And as I said, we'll wait till next July and see what the review comes up with. Okay, thank you.
Thank you very much, Councillor Ferris. I will
Thank
step
you.
out at that point. Thank you.
You'll step out. Okay, thanks, Jason. Who have we got for the carers support? Is it Philippa or Pete? Are they coming in?
Liz, Peter's with us, Peter Stokes.
Is he?
Hello.
Oh, sorry, Peter. You weren't on my screen. You are now.
Okay, good. Thank you, and hello, Councillor Ferris and other councillors. So this is for a Carers Grant Award, and the paper is seeking approval to award a grant of £32,872 for a period of 3 years to Carers Together, using funding from the Accelerated Reform Fund for a carers website, and also to delegate authority to Director of Adults Health and Care in consultation with yourself as Executive Lead Member to approve a further grant award to Carers Together for up to 7,000 for the same period above, dependent on further funding received from the Accelerated Reform Fund. The Accelerated Reform Fund is a fund which was positioned and is given to us by the Department of Health and Social Care as part of their ability, part of their commitment to reforming adult social care, and it's designed to innovate practice, build capacity, and align objectives to put people at the heart of care. Is the vision. The funding itself, as part of the Accelerated Reform Fund, was passed down from the Department of Health and Social Care to a consortium which had to be on the basis of the integrated care system. So in our consortium, it follows that we're in it with the Isle of Wight, Portsmouth and Southampton. As part of that, and as part of that funding which has been passed down to us through that process, the Hampshire County Council has received currently a total of £223,579 from the ARF fund in the first tranche. In terms of some of the priorities, there was 12 priorities which the fund sets out, on which we had to meet at least 2 of them in part of our expression of interest, and one of those had to be in regards unpaid carers. And the priority which we chose regard unpaid carers was titled Ways to Support Unpaid Carers to Have Breaks which are tailored to their needs. As part of our expression of interest to receive that funding, we put forward the intention to fund a website for unpaid carers with the Hampshire Carers Partnership. So some background to this in terms of the need for a carers website has been identified by the Hampshire Carers Joint Strategy 2024 to 29 as it's felt that a central information hub that links all community-based resources, service information points together, including information on carers breaks, was needed. This has been identified as carers don't always know where to start when seeking that information and advice and support, and has spread over numerous sources, including voluntary sector organisations as well. And it was really important to have that one-stop hub to it all. The Hampshire Carers Partnership itself is the group which is formed as a result of the Hampshire Carers Joint Strategy, and it's made up of carers, key partners and representative organisations and statutory agencies, including the County Council, that have an interest in supporting carers. As a result, and linked to that, the Hampshire Carers Partnership, who oversee the Hampshire Carers Joint Strategy, have assigned Carers Together as an organisation which is part of that partnership as the best conduit to develop this website, and hence the grant is looking to be sought to award to them. The grant cost of it is £32,872, and that breaks down, and that'll be funded fully out of that accelerated reform funding passed down to us from the Department of Health and Social Care. Year one setup costs and maintenance costs totaled £20,206 out of that amount, and with a further maintenance cost years 2 and 3 combined coming to £12,666. Now, in the recommendations at the start, I mentioned that we're a second tranche of our funding for Accelerated Reform Fund. This is due to be received from the Department of Health and Social Care shortly, and from this allocation, we've identified and put aside up to £7,000 costed to enable search engine optimization to drive people towards that website. This will increase the further reach in terms of when people use whatever search engines they choose to use, then type in carers at Hampshire, it'll be almost come up as one of the first hits, making sure we can get that information to them speedily and readily to make sure it meets their needs. However, the exact amount for what is required for that search engine optimization is still to be determined, hence the need to kind of delegate authority to the director in consultation with yourself once those costs have been identified and that second tranche has been secured into our accounts. As part of all grant, as you'll be aware, as part of all our grant activity, there's a grant agreement which both covers which both ensures that there's no ongoing commitment to existing funds, but it requires repayment if any part of it remains unspent at the end of the grant period, or if there was any material breach of the grant agreement. However, we've worked with this organisation closely for a number of years, and also the Hampshire Carers Partnership is a long-standing organisation in supporting that strategy, so we've got every confidence it will be fulfilled. In terms of the qualities impact assessment has been undertaken, and it's seen a positive impact for several groups, including both age, disability, sexual orientation, sex, and race. It's particularly in terms of race, what we've identified in this website is often for those, there can be a mistrust in certain ethnic groups about receiving information from directly from a statutory source. So having this website positioned externally, but then able to access the information about the services we can provide, should increase the reach to those unpaid carers within that community. Hence, that's the basis for the paper today and the recommendations brought before you.
Thank you, Peter. Just a couple of questions. The extra 7,000, do you have to apply for that? And is there any guarantee you'll get it?
In terms of the, we don't have to apply per se. We're due a second amount, and that's been costed in. We're just waiting for it to come. It's more of whether we choose to spend that full amount on it. So that's why we're kind of delaying. It's not included in this part of the award, and there's further work that needs to be undertaken to work out what that costing will be, or if it is required at all.
Okay. The other thing is, I think this is a terrific idea, and I'm really pleased Carers Together are in this. But how do you get hold of the people who become carers but don't recognise themselves as carers? There's an awful lot of older people who don't regard themselves as carers, but in fact they are carers.
Yeah,
and I don't know how you reach them. Sorry.
No, that's a very good question. It is a challenge, and it's something which I know that there's a further communications work which is being undertaken by Hampshire Carers Partnership as part of the Hampshire Carers Joint Strategy to look about how we increase that reach to those groups. Equally, that's something which the search engine optimization may be able to assist with in terms of linking it to the words they're searching for to hopefully put it up higher on their search engine when it comes to that. Jess, I see your hand is up. I don't know if you want to come in on that point.
No, not only to agree with what you said, and to say that from another perspective, Hampshire Safeguarding Adults Board have also took this up as a partnership issue across agencies, particularly with regard to GPs supporting us with recognising unpaid carers and getting them to recognise themselves as carers. So I think we are, and then I think the involvement of the voluntary sector is really positive as well. During COVID, when we were trying to find as many unpaid carers as we possibly could, we found that the voluntary sector had connections that we didn't have. So I think it's really positive that they're involved in this work, and so I do think we stand a really good chance of reaching more people, including the seldom heard groups that Peter talked about, because of this happening via the voluntary sector. I think that's really, really positive.
Thank you. Councillor Oppenheimer.
Well, that's been a good discussion. Just one thing to add, which is I look forward to seeing the website when it's finished. And I think councillors can then have a useful role in helping to disseminate it and promote it through our networks, parish councils, community groups. So, when the website's finished, let's do an email to all councillors about it. Thanks.
Yeah, we'll ensure that happens. Thank you.
Yeah, Councillor Withers.
Yeah, fully endorse and totally agree with Russell's comments there. Sending it out to all the councillors is a must.
Yes. Councillor Menahan.
Yeah, that sounds wonderful. Will this dovetail into Connect to Support Hampshire information as well?
Yes, it will. Definitely.
Okay, thank you.
Yes, it all has to be joined up in a way, doesn't it? Otherwise, we lose people. Okay, right. More than happy to approve, Peter. Thank you very much.
Thank you. And again, I'll leave you now.
Super. Right. June, I think the last thing I've got is appointments to outside bodies.
Yes, thank you, Councillor Fairhurst. It's a I have had some clarity on it. It's a single appointment, but what the hospital are the trust are trying to do is sort of share the workload across 3 people. So that's why there's 3 names there, so that they can try and get some continuity of people attending meetings. So that's why we're asked to appoint the 3 names that are on the report, as in the report.
Super, thank you. Well, we didn't have anyone before, so it's really nice that we've got 3 younger people rather, I should say,
yes,
who are willing to step up and do the work. So that's good. So happy to appoint them.
Thank you.
Thank you. Right, is that it? Well, I did say, Jess, I did say I wanted to finish early because of the next lot of meetings. Oh,
we have Councillor Oppenheimer.
Councillor Oppenheimer, over to you.
Thanks, Liz. Yeah, well, hopefully this won't take too long, but this is the final decision of the day, which is about the clinical champions, and I think Simon is here to introduce that item.
Yeah, many thanks, Councillor Oppenheimer. So this is a paper to seek approval to give a grant to Energize Me, who will also put some funding into this piece of work to develop physical activity clinical champions. We know physical activity is the best buy for health, and if it was a pill, every doctor would prescribe it. So this is about really upskilling our colleagues, medical professional, nursing professional and allied health professionals to increase their ability to talk about and enable people to be more physically active. It's a nationally prescribed programme that's well evaluated and will continue to evaluate it through the 3 years of the grant. Thank you very much.
Thanks, Simon. I'll just check if my councillor colleagues wanted to come in and comment or ask any questions. Liz, anything from you?
No, it's just that I think we talked about this last time. I'm a great fan of Energize Me, and I know the film they did of the let's say the ladies at Park. I believe you were going to take it and show it to HASC. I know we took it to the Health and Wellbeing Board. But
I don't think it's quite made it there yet, but we will do.
Yeah, but the difference it makes to people's lives when they get involved is really tremendous. Yeah, so very happy.
Great. Bill, do you have anything to comment?
No, I just think it's a great opportunity.
Oh, thanks. And finally, Leslie, I'll just ask you if you wanted to ask anything.
When you say upskilling professionals, is this about advising them what exercise is good for people? Is that what it is about? What is it actually about, the upskilling?
I think it's really about giving them the confidence to have those conversations with people, and the best way to approach it. As I understand it, there is quite a body of evidence, and there are some national resources that we're going to be getting for these clinical champions to use, and they'll develop their own training days, and there'll be a shorter version, a sort of 2.5 hour training. And yes, and then healthcare professionals will hopefully feel that they're then confident to go and talk to people about what they can do, to improve their health through physical activity. And let's see, with Jess and Simon will probably give a more professional answer than I just did.
No, not at all. I just wanted to, I remember reading a really stunning fact around GPs, that if people hear from a GP about activity that might assist them, then it's far more effective than other people telling them that. And then just was something that stuck in my mind. So we're back to the carers piece. I would imagine there's some work there to do with making sure that all GPs are doing that, taking advantage of that opportunity, the optimum. But Simon knows far more about this than I, so I'll hand over to him.
No, both have summarised very well. I think the thing is that medical professionals are not sure what to do, so actually it's how you empower them what to do. Yes, when can people go for a walk? There's those myths about if you've got back pain, don't move. Well, actually, no, keep moving. So it's really trying to turn that around a little bit and ensure that all professionals can talk about physical activity in an effective way that enables people to move.
Thank you very much.
Thanks. And yeah, I mean, I'm happy with the recommendations, and I would like to approve the recommendations that are at paragraphs 2 and 3 on page 41. I remember when I first heard about social prescribing when I was on the National Park Board, the South Downs Board, 6 or 7 years ago, and we didn't know what it was. It had to be explained to us. But, I'm glad that there is an increasing understanding and acceptance that physical activity, getting out for a walk in nature, is very good for your physical and mental health. And I hope these clinical champions will be part of helping Hampshire to get healthier. So yeah, I'm happy to approve this, and I'll look forward to hearing how it goes. We've got to try this sort of thing. Well, that was everything. Thank you very much. And I'll pass back to you, Liz, to close the meeting. Thank you.
Okay, right. All I'll say is thank you very much to everyone. Could say see you next time, but perhaps not. I'll see you later. Okay.
Bye.
Bye.
Thanks, everyone.
Thank you.
Bye.
Hannah, could you stop the webcast, please? Thank you.